Hi, and welcome back to my presentation, Poverty in the American South. What factors lead to higher rates of official poverty in the South and other regions of the country? Rates of poverty in the United States are higher than most OECD countries, and childhood poverty is especially prevalent around the country. All right. Um, and it doesn't really come as a surprise that the southern states consistently lead the nation in rates of poverty and low median household incomes. It's been like this for many decades. And this study is going to look at Alabama, Louisiana, Mississippi, South Carolina, and Tennessee. And, I chose these because they have some of the lowest median household incomes in the country, using a 6-year average from 2008 to 2013. Um, They don't have state minimum wage laws. They tend to be ideologically very similar in the Deep South. And so that's why I chose these states to study. Looking at those 5 states from 2008 to 2010, you can see the poverty rates. You can see the poverty rate for the United States at 14.2%, and then the other states. South Carolina comes pretty close in 2008, 2010. And then the confidence interval at 90%. And then from 2011 to 2013, um, the poverty rate in the United States did jump, but as you can see, these numbers are higher, and they're still higher than the um, total U.S. numbers. Poverty rates in these 5 states going back, um, decades, they've been higher than the overall U.S. poverty rate for forever, it seems. Um, and so the, the poverty line, okay, the Census Bureau uses poverty thresholds to determine who is in poverty. If the combined household income isn't over a certain level, everyone in the household is considered to be in poverty. And that is one of the reasons why childhood poverty is such a problem in this country, um, because of single parent households that have maybe 3 kids. Everyone in the household is to be in poverty. So you have um, 2 or 3 children who are added to the poverty rolls with in single family households if they have that many children. The poverty thresholds are updated yearly to account for inflation as a reflection of the consumer price index. And these are the poverty thresholds for 2013 by size of family and number of related children under 18. So you can see here, if you are just by yourself and you have no children and you're under the age of 65, then this is your poverty threshold. If you make less than this, you are officially in poverty. And if you are, let's say, married and you have 2 children, um, so there's 4 people in your household and you have 2 children, if you make less than this as a combined income of the household, if your combined income is less than this, then you too are in poverty and everyone else in the household. And you can see the scale here. Moving on. So, what factors lead to higher rates of poverty in the South? Um, the effect of a higher minimum wage, possibly. All right. Now, there's a lot of research out there on the effects of the minimum wage, and there's a big debate whether or not minimum wages should be higher Should they exist at all? But the research that I found tends to be positive toward the higher minimum wage. This study by Oberg and Aga in 2010, where they looked at the effects of the minimum wage on poverty, and their research was quite telling, and their conclusion is the capitalistic economic system, the vast majority of families that persons who are working full-time full year should be able to make a livable wage that will provide the means to meet families' basic need. However, unlike Social Security that has an annual cost of living adjustment, the federal minimum wage requires congressional action each time there's an adjustment to account for an increase in living. And that goes for the poverty rates as well. The poverty rates are adjusted, but the minimum wage isn't. The minimum wage has been at $5 an hour. Sorry, for $7.25 an hour for 5 years. And in another study coming from Harindrajit Dube, and he says that higher minimum wages increase incomes at the bottom of the family income distribution, reduce the percent of individuals living below the poverty line, and in particular reduce extreme poverty. Second thing I want to talk about is the effect of government assistance programs. And there are two types of assistance programs. These are the means-tested programs and social insurance programs. And means-tested are programs that are targeted to the neediest by providing benefits to people with low income or assets. And the major ones here, as you can see, are Medicaid, the EITC, which is the Earned Income Tax Credit, the SSI, which is the Supplemental Security Income, SNAP, which is the Supplemental Nutrition Program, and TAMF, which is basically like welfare. SNAP is like the food stamps. And these are means tested. Then there's social insurance, which provides benefits to the whole population in times of employment, disability, inability to work in old age. So the major ones there are Social Security, old age Social Security, survivor social disability, Medicare, workers' comp. Okay. And so this study from Ben Shalom, Moffitt, and Schultz in 2011, and their study is based on looking at the poverty rates from 1984, 93, and 2004. And they looked at, means tested, and they looked at social insurance, and, they looked at how the government assistance affected poverty rates. And you can see here, after extensive research, they found that all of these things, means tested and social insurance, reduced poverty rates and near poverty rates by about 14 percentage points in the U.S. population as a whole in 2004. The other nice study that I looked at was this alleviating poverty in the United States, the critical role of SNAP benefits. And SNAP benefits is it's part of what I'm going to be doing in my research. So in here, the researchers used 10 years of cross-sectional data from the U.S. Census Bureau's annual social and economic supplement to the current population survey. And they found that the average decline from 2000 to 2009 in the Child Poverty Gap Index was 15.5%, while the average decline on the Square-Based Gap Index for children was 21.3%. And so it says here at the bottom, it says, our analysis of the poverty gap and squared poverty gap indices makes clear that SNAP plays an important role in improving the welfare of individuals in low-income households, and that SNAP benefits reduce both depth and severity of poverty in both metropolitan and metropolitan areas. And the last thing here is educational outcomes in poverty. Going through the research, the effects of poor education on poverty and the effects of poverty on poor education, they go hand in hand. And it's one of the biggest contributors to the poverty cycle is that people can't make money. They don't get jobs. They don't have school. There's they're not ready for school to start, when they're babies, when they're going to preschool. And so you can see here readiness, educational quality, and attainment. These are three really important things. Children need to be ready to be able to go to school. Closing the gap is extremely difficult. The child starts significantly behind their peers. Educational quality. Schools that tend to be in low-income areas tend to be poor schools with poor teachers, unfunded. Students don't want to go there. Sometimes they're unsafe. They they check out. They don't finish, and then that leads to low attainment. Where you finish in school, and it's a well-studied fact that people who do not finish high school make considerably less money over a lifetime than those that do. And then as you progress in getting your associates or bachelor's, pushes wages up further. High school graduates have a much better chance of escaping poverty. And that's true. And so we need good schools if we want to have less poor people in this country. And so my research design will look at the relationship between poverty in Mississippi, Alabama, Tennessee, South Carolina, and Louisiana, and the minimum wage, government assistance, and educational outcomes. And the research will employ a time series regression for the years 2008 to 2013. And a dependent variable will be the percentage of people below the federal poverty thresholds in Mississippi, Louisiana, South Carolina, Tennessee, and Alabama in the years 2008 to 2013. And the independent variables will be the median wages per hour of people making between $7.25 and $10.10 who also sit 130% of or below the poverty threshold. Second will be the ratio of people 130% of or below the poverty threshold enrolled or not enrolled in the SNAP program, and the percentage of state budgets used for primary schools. I believe that multiple regression should tell how well each independent variable predicts the dependent variable controlling for each of the other independent variables. Um, and so that is my presentation. Ultimately, I think that the statistical analysis, and after everything's said and done, I can expect to see a clear picture of how low minimum wages, people enrolled in SNAP, and state primary schools budgets affect poverty rates in the South, in these 5 states in the South. So thank you very much.